the first one we're doing is just to get the athlete used to the movement of the wide stance good morning. So we're going to do without weight. So go ahead and bar up here for us. We're going to go wide feet. We're going to keep a locked leg, feet straight. All we're looking is to displace the hips going backwards. So we're just looking for a hip hinge without allowing the knees to bend. But just drive those hips back. When our hips stop moving, we stop moving. We're going to have big toes pushed into the ground as we come straight up. Legs are locked, pushing those hips back. Drive those big toes into the ground as we come up. We're using the big toe to integrate into the hips. So when the big toes, when we come out of the hole, the big toes press, we're going to get more activity out of our hips. So I don't care what the range of motion is of the athlete. We're not looking for them to pancake. We're just looking to get this angle so the load is posterior. We'll go right into the first one. And we're going to use asymmetrical load to challenge the athlete's ability to stabilize. So we're just going to put a simple 10, but that's going to be actually pretty heavy. We're going to do the same movement, but it should look the same. But he's going to have to use a lot more stability work through his lower back hip complex to accomplish the same task. So the asymmetrical load just challenges some of those ab walls that we were seeing on the underdevelopment last time, because of the way his hip didn't move well. We've got some lengthening happening through his adductor group, including that gracilis and the adductor. The gracilis passes the knee, which is why I want the knee straight. If we unlock the knee, we unload some of those muscles that cross the knee. So that's the importance of that cueing point. Grab from the big toe coming up. Excellent. So the reason we're just picking something like this barbell movement with asymmetric load is we're getting an integration of how his adductors, how his ab wall, his obliques, his QLs, and the erector muscles are all working together. We're just basically getting to have a coordination between some things that he hasn't been using in the last month or so. So as he's lengthening under load, we're compressing under load. Some things that we're trying to do with that X pattern, the left adductors working with the right oblique wall and vice versa, creating that X pattern. And by just making it an asymmetrical load, we can use a lighter weight because he hasn't been doing as much, but we can get a higher intensity.